If you've been trying to conceive a child for a while but things don't seem to be working, there are a number of treatment options available to you.
What treatment is appropriate for you depends on a number of factors, such as the cause of infertility,
How long you've been trying,
the woman's age.
and of course, your own preferences.
Where there is a choice, most people prefer to start with the simplest treatment and then move on if that doesn't work.
Trying naturally for a bit longer may be an option for some people, especially when the woman is younger, when infertility is unexplained, or only mild factors are found, and when the length of infertility is quite short. About 30% of people in this situation will become pregnant by themselves within the next 2 years.
The simplest medical treatment is using a pill called Clomiphene citrate. There are no injections and you still have sex to become pregnant. Clomiphene is mainly used for two groups of people: women who don't ovulate or who have irregular cycles, and women with a shorter duration of unexplained infertility. If you fall into these groups and are 37 or younger, then you have a 20 to 30% chance of having a baby within 3 to 4 months of Clomiphene treatment.
The next step is IUI. IUI involves preparing sperm in the lab and then putting the best sperm directly into the uterus in a procedure that's a bit like having a cervical smear. IUI works by giving sperm a head start in their journey to the egg. It is often combined with mild fertility drugs like Clomiphene to increase the number of eggs available. It involves some blood test and an ultrasound scan. IUI is usually offered as a package of up to 4 cycles, which gives younger women a 30 to 40% chance of having a child.
IVF can be used for nearly every cause of infertility: poor quality sperm, tubal damage, endometriosis, ovulation problems, and unexplained infertility, which means it's widely used. IVF starts with drugs to increase the number of eggs. Eggs are collected and sperm are added to them in the lab. When sperm quality is poor, an individual sperm can be injected into an individual egg, which is called ICSI or ICSI.
2 to 5 days after egg collection, the embryologist selects the best embryo for transfer into the uterus. Any good quality spare embryos can be frozen for another chance of pregnancy. An IVF cycle gives younger women a 40 to 50% chance of having a baby from a single treatment.
So far we have been talking about using your own sperm and eggs. Donor sperm is an option where there are no sperm, sperm doesn't function properly, or for lesbian couples or single women. Donor sperm can be used in IUI or IVF. It's quite common for people to start with donor sperm in IUI and later move on to IVF if they do not become pregnant using IUI.
For women who have undergone menopause early, or whose eggs don't fertilise normally, or because the chance of pregnancy is very low because of their age, donor eggs are an option. Donor egg treatment is basically IVF split in two. The donor undergoes the first part of IVF treatment, while the recipient receives the embryo.
Embryos may also be donated by couples who have completed their family but still have frozen embryos stored.
Surrogacy is when a woman carries a child for another person. In New Zealand, this is nearly always IVF surrogacy, which means that the embryo is created using IVF and then transferred into the uterus of the surrogate.
Surrogacy, donor embryo treatment, or using combinations of donors requires approval from the Ethics Committee on Assisted Reproductive Technology, or ECART.
Alternative options and complementary therapies can be used alongside your treatment if that's your preference.
There are many options out there, and we encourage you to take control of your own fertility journey. There are lots of good websites that will help you research your options, and the great people at Fertility NZ are here to help you get the best information for your own situation.
Of course, infertility is not just a physical problem. There's also a huge emotional hurdle to overcome. It is a life crisis, a threat to your dreams for your future.
As well as the loss of the family you've always dreamed of, is the effect it has on your self-image and confidence. The loss of control is hard for many people, as is the feeling of putting your life on hold while you attend appointments, wait for test results, and research your next move.
Anger is a natural reaction to this unexpected disruption to your life's planning, and along with the grief, can start to colour the way you see the world.
While they are normal reactions to such a crisis, these emotions need to be processed so they don't engulf you. A good way to do this is to see a specialist infertility counsellor. They are based at fertility clinics, but you don't need to be having treatment to make an appointment. These people are there to listen to you. They can help you identify your emotional responses, give you coping strategies, and help you consider the options available to you.
Another good option is to attend a Fertility New Zealand contact group where you'll meet others experiencing similar challenges and gain information and support in a confidential and safe environment.
It's also really important that you take good care of yourself. It may seem obvious, but the importance of good nutrition, exercise and sleep habits cannot be overstated.
As well as this, give yourself regular breaks from thinking about your fertility struggles. Do things you enjoy, get some pampering, have some other goals to achieve or exciting events to look forward to. It is hard to face a fertile world every day, and you deserve some time off from putting on that brave face.
This infertility journey ain't easy, but as Michael Jackson said, you are not alone. Please contact Fertility NZ if you think we can help.